Hi, I'm Dr. Nathan Patterson, and I'm going to talk to you today about breast implants and choosing the right one for you. The right implant is important for each patient, and it's a very individual choice. So there may be differences between styles of implants, the construction of the implant, or even the shape of the implant. And so it's important that as a patient, you don't come in locked into one implant option that may not be just right for you. What I mean by that is that everybody is individual. Everyone's shape is a little bit different. Everyone's questions and concerns are a little bit different. And so the right implant needs to be carefully selected for the right patient. So basically, implants are all made of a silicone shell. They used to be much thinner than they are now. Now they're somewhat thicker and they're more durable. But the basic difference between saline and silicone is that saline implants, like this one here, are a silicone shell that comes from the factory empty, and we fill it with saline, which is sterile salt water, in the operating room. They have a fill valve on the top, and they are inserted with a filled tube into that valve, and then they are filled with the desired volume of saline during the operation. Whereas silicone implants are filled from the factory. Silicone implants do not have a fill valve. They have a volume that we have pre-selected based on the patient's desires and the patient's measurements, and there is no way to change the volume of this implant. There are differences in their characteristics and how they behave in the patient, and there are differences in durability as well. Most people think that the silicone implants feel softer and they probably last a little bit longer. They tend to ripple a little bit less than saline. Saline implants, on the other hand, tend to ripple a little bit more, and you can see that rippling especially if you're a very thin patient or if there's not much breast tissue to camouflage or hide the contour of the implant. Saline implants tend to feel a little bit more firm than silicone implants, and they may not last quite as long. So implants can come in various shapes. What I mean by that is they are most of the time round in their kind of basic outline, but some have a teardrop shape and some have a dome-like shape. So a round implant, for example, this implant that I'm showing right now, is a dome-like implant that doesn't really have a top or a bottom. It does have a front and a back, but it doesn't really have a left side or a right side or a top or a bottom. Whereas a shaped implant, like this one, has a front and a back, but it also has a top and a bottom. So the top would be here, the bottom would be here. What that really translates into is a more teardrop shape, which is more accurately analogous to the natural breast shape. So it mimics the natural breast shape of a little bit less full at the top and a little bit more full at the bottom. So there's a lot of debate about that, and there is not one right answer for everyone. The basic answer is most of the time we put implants underneath the pectoralis muscle. Sometimes implants are placed on top of that muscle. Those terms can be alternately called things like subpectoral or submuscular for under the muscle. They can be called subglandular for on top of the muscle. As far as what's right, most of the time we put implants under the muscle, but for various reasons of revision surgery or just patient preference or even patient activity level, we may put the implants on top of the muscle. So again, it's not easy to say what's always best for every single person, but the basic incision approaches are most commonly the inframammary fold, which is the natural crease or fold underneath the breast. The second option would be transareolar or circumareolar, which is where an incision is made right around the edge of the nipple. A third option would be through the underarm position, called transaxillary approach. And for historic significance sake, I would say a fourth option would be through the belly button, which was at one time popular in some places, but that was called a transumbilical or tuba approach. That is rarely done anymore. It's not really the best way to do it. It's a little bit more challenging to do that. Even with a silicone implant, it may not be possible to do that approach. To back up a little bit, most implants are placed through an inframammary fold incision, or what we call an IMF incision. One reason that's a good incision is you can actually see the best what you're doing. you are dissecting through the least amount of tissue to make the pocket where the implant goes, and you can control what's going on in the operation you have the most control. You can see the best what's going on there. Some people prefer an axillary incision. There are some downsides to that. It requires some different equipment. You can't quite see as well what you're doing, and it's not always easy to fit the implant through that sort of tunnel you have to make to get it in the right position. That doesn't mean that no one can get that approach done safely. It just means that if that approach is going to be taken, there needs to be some considerations. Thank you for watching today. If you have any further questions, please contact us at pattersonplastic.surgery or call us at 850-484-7546.